Welcome to today's event entitled Inclusivity in a Post-Pandemic World. My name is Michel Hawks, and I'm Director of the Liu Institute for Asia and Asian Studies at the University of Notre Dame. The Liu Institute is responsible for promoting teaching and research about Asia at Notre Dame, as well as for academic engagement with universities and other constituencies in Asia. We are delighted to organize today's event in partnership with Notre Dame International, the university's international office, and with our global center in Mumbai, led by Mr. Dheeraj Mira. And we're very grateful to all of you joining us from Mumbai. I know the weather is terrible right now, and I hope you're all safe and well. Today's event is the last in a series of 3 online discussions aimed at connecting Notre Dame experts with scholars, practitioners, and audiences in Asia to discuss the theme of global fragility against the background of the current public health crisis. As an ethically grounded university with a strong sense of social engagement and promotion of the common good, Notre Dame and its faculty share deep concerns about the increased fragility of disadvantaged individuals, communities, and places around the globe. And we are committed to help work towards solutions that will prevent the return to the unsustainable practices of the old normal. To discuss the specific topic of inclusivity, we have with us today 3 eminent speakers, all of whom will speak for around 10 minutes, followed by a discussion based on audience questions. Some of you have already submitted questions in advance. You can also type questions into the Q&A window during the event. The event will finish on time after exactly 1 hour. Allow me now to briefly introduce our speakers in the order in which they will present. Alex Montoya, a 1996 Notre Dame alumnus, is a motivational speaker and a Chief Motivation Officer for A Motivational Communications based in San Diego. Much of his inspirational message addresses disability awareness and draws from his own experience of living with 3 prosthetic limbs. He is the author of 6 books and has lectured at such organizations as Google, NASA, and Harvard. He carried the Olympic torch for the 1996 Summer Olympics in Atlanta, Georgia. Born in Colombia, Montoya is the recipient of the Medal of Honor from the Colombian government. He also received a Lifetime Achievement Award from the San Diego Hispanic Chamber. As a TEDx speaker, Montoya was named a Paul Harris Fellow for Leadership by Rotary International. He is on the board of directors for the Gourmillon Foundation, which supports people with disabilities in San Diego and Tijuana, Mexico, through grants and scholarships. Our second speaker, Mala Ramadarai, is chairperson of the City Academy for Special Education in Mumbai, India. She has been passionately involved with children and various aspects of teaching and learning for around 30 years. Having worked in a renowned Campion school in Mumbai, Ramadarai went on to become the vice principal at the prestigious Bombay International School. She has also held the position of head of training at SchoolNet India. A board member of several trusts engaged in education, Ramadarai formerly served on the board of Reach to Teach, an NGO headquartered in the UK, committed to enhancing teacher-child interaction in the government-run schools in Gujarat, India. Since 2004, she has been the chairperson at City Academy for Special Education, the education therapy department of SRCC Children's Hospital in Mumbai, devoted to imparting education and life skills to children with a variety of learning difficulties. And our third speaker, Neeta Verma, is the Robert P. Sedlak Jr. Associate Professor of Visual Communication Design at the University of Notre Dame and a faculty fellow here at the Liu Institute. She situates herself within the discipline of visual communication design, viewing the profession of design both as service and collaboration aimed at social equity and justice. Throughout her research, she has defined her role and the role of design as one that serves as a catalyst within a societal context. Her research and teaching focus on social design, examining the intersection of social innovation and collaborative practices and visualization of data, explored within the context of aesthetics, ethics, and politics of representation. Her current research, supported in part by a grant from the Leo Institute, focuses on designing for the visually impaired. Her work with visually impaired girls in India has been presented at national and international design conferences. It is also the winner of the prestigious National Core 77 Award and the International A Design Award in the category of Design for Social Impact. Our American Sign Language interpreter today is Colleen Geyer from Community Services with All Deaf. We are very grateful to have her with us. And now, without further ado, I'd like to hand over to our first speaker, Alex Montoya.
It is very fascinating that we are discussing COVID-19, certainly in unprecedented times, but also in the backdrop, against the backdrop in the United States of the 30th anniversary of the Americans with Disabilities Act. The Americans with Disabilities Act, the ADA, was, of course, the most sweeping and important civil rights law for people with disabilities in history, in our nation's history. July 26th was the 30-year anniversary, and it's very fascinating to see all of the issues that have come up regarding COVID-19 against the backdrop of such a historic anniversary. As the death toll of COVID-19 has moved past 150,000 American lives lost in the US, we have analyzed how the virus has impacted countless groups. If you look at all of the multitude of news and online chatter, it's examined the health and economic impacts on such groups as senior citizens, people of color, youth and babies, people that live in coastal states versus metropolitan states versus Midwestern states, small business owners. We've debated the effects of the virus in every age group. We even looked at the effect of whether people, again, live in bustling cities where they primarily travel in enclosed subways or trains versus those that live in wide open spaces full of beaches and ranches and large acres of land. So we've looked at every single group and how the virus has impacted those groups and whether some groups are more vulnerable than others. But there was one group that really has not been examined as carefully as it should be examined, and that is people with disabilities. That is a group that covers every socioeconomic group that exists, and it's the only minority that you can join in an instant. I'm going to repeat that. People with disabilities, the disability community, is the only group that if you are not a part of that group, you could become a part of that group in an instant. And so it's something that we should all really be mindful of. And of course, even if you are non-disabled, surely you have a friend or a loved one, maybe a family member, someone that has a disability. So it's very impactful for all of us and very mindful for all of us. As we look at the COVID-19 virus, but also the shutdown, it's very vital to remember that there is not a one-size-fits-all solution to all of the problems that we are looking at. Particularly when you look at the virus itself, there are many people that are even greater at risk because of compromised immune systems. For example, many of those that have weakened bronchial or cardiovascular concerns as part of their disability, or for example, those with spina bifida sometimes have compromised throats and lung capacities, which make it harder in managing congestion, germs, or illness. In terms of the quarantine itself, you look at the issue of wearing a mask. Now, I proudly wear a mask wherever I go. I will continue to proudly wear a mask, but it does also pose some challenges that we need to look at and be solutions based. For example, if you are someone who is deaf and relies on lip reading, suddenly you cannot see the other person's lips that are in front of you. So we need to continue to develop a way for people to wear a mask, but also for people who are deaf or hard of hearing and read lips to not have that ability compromised as well. The third issue that I hope we can look at is the issue of seeking supplies within this pandemic and within the shutdown in the United States. Imagine if it was tough for you to head to the store and look for toilet paper or paper towels, hand sanitizer. Imagine those that utilize wheelchairs, prosthetics, or service animals. Fighting crowds and arriving to storefronts with empty shelves is even harder for these persons. Furthermore, it's also illuminated one more issue that is not often discussed. Oftentimes we hear about people getting cabin fever and really being frustrated by being at home within this time of the pandemic. It really illustrates an argument that has been made for decades, really since the 1960s and 70s, if not before. Those that are a part of the independent living movement have argued that people with disabilities, if at all possible, should not be confined to a home or should not be in a situation where they are indoors 24/7. They need to be able to be out. They need to be able to be in public and have enough government funding to supply their needs. Otherwise, they are enclosed all day long, 7 days a week, and there are various physical and mental illnesses that can arise from that. Finally, I'd like to address a little more of a bright spot or a little more of a positive aspect, which is as we look at this pandemic, let us also not be afraid to be inspired by people with disabilities. As someone who was born with a disability, I had a congenital birth defect that led me to be born as a triple amputee, and I wear 3 prosthetics. I have learned as part of my lifestyle to rely on my faith and also to know that each day is going to be a process of adapting and adjusting, that I need to adapt and adjust to any challenge that is put before me. People with disabilities have that as a mindset, and they have that as part of their internal DNA, and they know that adapting and adjusting is just something that we do to survive. And I encourage everyone to adapt that mindset in order to survive this pandemic. I certainly encourage all to continue wearing a mask. It not only protects you, but it protects all the people around you. You are protecting the most vulnerable among us. You are acknowledging the truth that many people have been asymptomatic and still infected others. If you are sacrificing this convenience for the sake of others, even people you have never met, you are still saving lives. And then also, finally, please check on your friends. Oftentimes, people with disabilities do not want to appear burdensome and do not want to appear even more challenging or troubling to others. But again, imagine if it's hard for you to get to the store and get food and get cleaning supplies and things of that nature. It's even harder for people with disabilities. So continue to check on them, continue to know that their needs are met, and please, please wear a mask. You are quite literally saving lives. The most important aspect about people with disabilities is that we are your friends, we are your neighbors, and we are your loved ones. We are you.
Thank you so much, Alex, for getting us started on the panel and for sharing your thoughts and experiences, and also your message about being inspired. We are certainly inspired by your example. We're moving on now to our second speaker, moving into the area of education. So I'd like to hand over to Mala Ramadarai.
Thank you, Michelle. Good morning, good evening, everyone. I was thinking about inclusion and was looking and very surprised that till 50 years ago, There was no talk of any kind of inclusion or anything in the education sector. Exclusion, meaning not even recognizing them, people with any kind of a disability, as people who deserved an education. I think this was something which was followed almost till the 1970s, early 70s. Then slowly, I think the parents of those children who were affected, they got together and they said that there needs to be some kind of a change in the policies. So slowly, I think this exclusion became kind of a segregation where there were children were isolated and were taught in separate schools, and then there was sometimes there was no adaptation. This kind of integration was no adaptation. The education system would stay as it is, and children, if they fit in, they would fit in, and if not, that was their problem. So this was another kind of a problem. Then slowly, inclusion. Inclusion involves a total kind of a transformation in policy, in the entire education system, in teaching methods, in assessment, curriculum design, almost everything. I think if you need to look at total inclusion, there needs a lot of work to be done in the education sector. So we need to be not tolerant, but actually totally inclusive. So I was reading some of the statistics. As usual, when you are in a profession or when you are involved in one particular segment, I was looking at my segment as special education. And then when I looked up and then looked at all the kinds of, look at the migrants who were trying to walk home, actually in India, when the lockdown was announced, realized that so many children were there who had just have to leave school, and they were just following their parents without even understanding, without even knowing when they were going to get back, or were they in schools at all before this. So one of the things that came to light was that 1 billion children are unable to get back to schools. And apparently, even those children who are getting educated, almost 617 million children and adolescents are unable to reach even minimum standards. Now, what do we mean by this? Which means that we are not talking about children with learning disabilities. We are talking about so many other differences. Marginalized population, as we call them. Poverty, which is of course something which is really staring at us in the face. In almost every country, it's not as though it is something that is an Indian problem, that kind of a difference. Race, which is ethnicity. In fact, I and my husband run a very small foundation, charitable foundation, to help children in the rural areas. Of course, the rural and urban divide is huge again, in terms of education, in terms of other kind of vocational opportunities and everything. But when we were talking about the rural population, when we went to help them, we realized that there was a small community which was totally engaged, called the Irula community, which is engaged in catching snakes. So this was something which the other people didn't like or were very scared of, and they totally wanted to keep these people out of the villages, and so their children never got an education. In fact, at one time when I had gone to meet them, the Irula community, they were saying that some of us have even come up to a graduation, but nobody is willing to give us a job, because the minute they realize or they see that we are from this community, there is absolutely no way that we can cross these barriers. Social reasons, of course, and then we cannot talk, and gender is something that we are really, really struggling with, the gender divide. That girls, rather that a girl is taken out of school and the boy goes to school, and that is the preferable scenario. So when you're looking at all this, and you're looking at, it is said that even in the lower income countries, 79% complete schools, in the 20% of the richest households, but 34% is the completion rate of 20% of the poorest households. So you can imagine that whether it is the pandemic or whatever, there is a huge divide between these, children who have and the children who don't have. So this has become so much worse now. And because this is going to be a long-term health and welfare problem, we realize that this is a situation that we need to cross somehow. And at one time when I was looking at this problem, I felt that maybe looking at the way the whole world is being cracked open, actually, literally, everything has to be re-examined, maybe it's an opportunity. Maybe we can right many of the wrongs that have been happening. And maybe technology could be one of the solutions to many of our problems. But the online people who are able to connect online, even in India, where you say that there is so much of connectivity, just 36% can be online. Only 46% have TVs or radios. And this is really something which is a terrible situation. So all the children, migrant workers' children who have gone back without being able to attend schools, the government and everybody else assumed that they would be online and they would connect. And I have a school, as you've just heard, we have children with learning disabilities, and I have a mix of people in there. Some people who are wealthy enough to have maybe a computer which is dedicated to that particular child, and some of them who don't even have a means of connecting or being able to charge their phones. So we realized that about 10, 12 of our children didn't have phones, no connectivity. So we had to correct that first, and now we are on online education. So that's what we are doing just now. So we are doing online education for all these children. And one of the interesting things that I was reading about in the paper was that in one of the rural areas, the people there in the district realized that the children don't have any education at all, and they were totally out of it. And so they installed 6 loudspeakers in the villages of, this was a village of 300 families. And then the teachers went, they created some content, and they went distributing this content to the people, and they earmarked houses with literate members, and then they gathered 8 or 10 children there, and they used to interpret whatever came from the loudspeakers, and they were trying to teach the children English, conversational English. So you can imagine this is something which is going to be quite an insurmountable problem, the way I see it. So all the content has to be customized. We are talking about content which may be there, collaborations which have come up. There's some of the things which are very, very positive is that the government, the private sector, everybody has now got together, because this seems to be quite a big problem. And they all have to put their heads together. Try to make all the connectivity as ubiquitous as possible. Try to connect all these children. Get all the teachers trained again, trained to be able to deliver online education. And I have been watching my classes and my teachers trying to impart an online education to children who are marginally autistic, children who have dyslexia and dysgraphia and attention deficit problems. It is a very tough task. I was talking to another special school and people who deal with a lot of children who have profound autism, and we realized that they are actually recording their lessons and sending it home to the parents, trying to talk to the parents, as we also do. We tell them in advance what they are supposed to do, how they are supposed to receive this, how they are supposed to talk to the children. And we have counselors who also are on hand to be able to help them. It's a very, very, very difficult task. And this kind of content development which is happening maybe is for the good, and we can have quite a number of this kind of a compendium of a lot of resources. Governments are trying to do their level best to open all their textbooks, their libraries, all these for children to be able to, youngsters to be able to access and to be able to continue education. Some of the places, I think they have found that children who lose out on education between the ages of 3 and 5 have a tremendous task trying to catch up again. Because this is going to be something that they can never ever regain. It is one of the best developmental periods that the brain has. And it's going to be a very tough task for us to give that time to them again. So through COVID, I think there have been a lot of developments which need to happen. For instance, in India, as you know, there are more than 200 languages. So we have a language barrier, and we have a lot of children who can access by themselves, and some of them may need somebody else to access it for them. And whereas the parents are busy with their own online work, and sometimes the siblings are not there, or we have 2 siblings or 3 of them trying to share one device, all these things do happen. So I think the online software industry is looking at a huge influx of business right now. So Byju's in India, and Tencent in China, and DingTalk, and we have the Lark in Singapore, and all of them are really giving a lot of content, and I think they need to change some of the content, because some of the content, maybe like BBC in UK, is trying to broadcast through the TV. And we have, one of the things that has happened now because of this pandemic is that Imperial College, they have, I think in Coursera, they have more than really so many people who have just enrolled in it in 2020, one of the maximum amount of people to have enrolled right now. So even though the access, internet access may be maybe 95% in Switzerland and Norway and Austria, it's just 34% in Indonesia. And even in the US, 25% do not have access to the internet. So what are we talking about? We are talking about a huge divide. Whether it's COVID or not COVID, I think we are in such a place right now that we should be thinking about using blended learning. So going forward, I think this may be one of the solutions that we can offer, that even children who are in remote areas, for them, we could maybe, if they have enough resources, or we are able to give them or share the resources with them, we may be able to offer quality education for them. A lot of things need to be changed. A lot of training needs to take place. And I think this COVID is one time when all the parents are really, really appreciating their teachers. They realize how difficult it is, and how much the teachers are working. The teachers have really risen to this. And we realize that this is a very, very difficult time. But I think it's opened up a huge number of opportunities. So I hope we are going to discuss those better opportunities to come because of COVID. Thank you.
Thank you so much, Mala, for taking us through the issues related to inclusivity in education, and also for giving us more information about the situation in India. So I love these Zoom meetings. We go from San Diego to Mumbai, and now within a matter of seconds, we return to the center of the world, South Bend, Indiana. And I'm delighted to hand over to my wonderful colleague, Nita Verma. Nita, please go ahead.
Thank you, Michelle, and thank you to the other panelists. Such a pleasure and honor to be here. I think one of the things that we need to be cognizant of is that a lot of things have changed. With COVID, what is normal is not normal anymore. So there are paradigmatic shifts. my work, as Michelle, when Michelle introduced me, my work is basically with the disabled, but my specialty is working with visually impaired. But what arises out of the research is applicable as much to visually impaired as much as it is to the disabled. One of the interesting things that happens when you talk about disability is that we think of disability as a singular condition, but it is not. It lives in a spectrum. And that is what makes it more complex. Not only are there different types, but there are also different degrees of disability. Coming back to the pandemic that we are in, because most of my work is located in India, I was very amazed by one of the studies that was released actually on July 23rd, that was conducted by a group called Swabhiman, and it talks about 43 lakh disabled students across the northeastern state that will have to drop out of education because they do not have access to technology. Something that Mala just mentioned, it's a very poignant point that she raised, but from a design point of view, it becomes even more poignant because the underlying reality is that these children are in government schools. They come from extremely poor families, and a large portion of them do not have access. So from a design point of view, in a way, the solution that we are looking at is a solution that is not really workable. And so what you do is you take the disadvantaged and you put them in a more disadvantaged position. But that is something that needs to be looked at. That brings me to this whole discussion about disability, and it in a way sets a stage for talking or thinking about disability. One of the most important things is that in society, when we talk about it, when the way we say it is the way we see it. And therefore, the way we define disability and the way we talk about disability sets up certain conditions in the way we look at disability. And therefore, you know, one of the most important things is the way we talk about, the way we define, and the words that we use to, the terms that we use, the language that we use to define. The way of acknowledging a whole constituency is to give them the due that they deserve. And therefore, you know, when we use terms like slow learner for people who have learning disabilities, or retarded for people who have developmental disability, or cripple for people who have physical disability. What we are doing is we are creating, first of all, characterizations. And then secondly, based on those characterizations, we create power structures. That we say that if you are able, you are more, and if you are disabled, you are less. And then words like poor, or unfortunate, special needs, they basically start calibrating the kind of response, social responses that we start taking towards these people. So as a result, what happens is these things start, you know, becoming subversive, but they start creating very unconscious biases and unconscious marginalizations. Now, what is very important when we are talking about disability, I think it's very important to understand the kind of marginalizations that we as a society create. And some of those, they are usually four. The first one is, of course, the physical differentiation, or the physical marginalization. But the four that really affect are the psychological, the sociological, the physical/financial, and then the cultural. And let me talk about these because in a way that sets up the way we look at disability. The first one is psychological. And within psychological, there are two aspects. There's a positive and there's a negative. The psychological effect, when you marginalize a whole people, what you do is you say that you are less than us, that you are dependent on us. But if you look at it from the cognitive side, what you understand is that the cognition that some of these people who have with disabilities is far greater and far more sophisticated than those of us who have the abilities. And we do not realize that, and we are unable to recognize that because it changes from person to person. There is an act of sensory substitution that happens, that if you cannot feel, you compensate with another. And therefore, these people actually have greater abilities sometimes than the people who have abilities. And that is sometimes hard to recognize. So the first thing, when we start to marginalize these people, one of the things that we have to understand is that they sometimes are far more capable than some of us. One of the interesting things, especially in working with the visually impaired, I have found, because haptics is such an important aspect, that the touch, but more than touch, the hearing is used as a very compensatory tool. And therefore you'll find there are a lot of visually impaired that sing extremely beautiful because of their ability to follow sound, their ability to follow, to really, their thresholds are far greater in understanding the structures of sound. Then we come to the second reason for marginalization, or rather the second effect of marginalization, which is sociological. Most of our society works within the 68% of the norm. If you look at the normal probability curve, we look and we respond to that 68%. If you happen to fall anywhere outside of that, you are basically, marginalized, or you are overlooked, because that is not where the mean is, that is not where the average is. And therefore, not being part of the 68%, you pay a price for that. And that creates a lack of inclusion, because if you are within the 68%, oh, you are the in crowd. But if you're outside the 68%, you become marginal. The third is the physical, financial. The physical world that we create around us is related to the sociological, which means that we cater to the 68%. We do not build ramps, because the ramp, creating a ramp means creating past the 68%. So what is the most, the least that we can do? So what that creates is, of course, there are reasons, there are economic reasons for not being able to do something. But if you look at the initial example that I gave you, the complete reliance on technology, on online learning, is an assumption that you have to have a phone or you have to have the internet. Now, is that possible? If that is not possible, then the very premise of the design of translating something into bringing learning from a classroom, from a physical classroom to this, becomes an impediment for a majority of people. The third one is cultural, where perfection is celebrated in all aspects, physical, mental, in all ways. What culturally we do is we try to, even within the 68%, there are those that are celebrated more. And again, it is going back to the spectrum. The more perfect you are, the better you will be accepted. The less perfect you are. So these are some of the things that end up, creating the ecology within which we perceive disability, and the ecology within which we kind of look at some of these things. My work is very specifically with the visually impaired. And I locate my work in India because 40 million in India suffer from visual impaired, and this includes 1.6 million children. The reason I work with girls is because I have personal experiences within my family, which has led me to pursue not just design solutions for girls, for the visually impaired, but girls, because there is greater disadvantaging in a way that is happening with that constituency. Most of my work is based on creating environments. Most of my work is invested in creating educational aids that can be used in classroom that are absolutely designed for the visually impaired as opposed to the normal populations. And the role of haptics, the role of touch, and the role of haptics is very prominent in my work, and how it allows the people who are visually impaired to acquire the same kind of information that we as normal human beings acquire through vision. So that is basically, the extent of my work. Now, in these COVID times, the times of the pandemic, I think we need to be given our basic instinct to marginalize. I think this is a time that we really need to rethink some of our attitudes towards this constituency, and hopefully, find opportunities in this pandemic. Thank you.
Thank you. Thank you so much, Nita. And thank you to all panelists for starting us off on this discussion. We have several questions coming in, and as mentioned, we've had questions coming in beforehand as well. I'll address the questions to each panelist individually, and let's try to get through as many of them as we can. So please try and keep your answers brief if you can. Alex, if I could turn to you first. There's a very interesting question that has come in about remote work during the pandemic. All of a sudden, during the lockdown, companies and other institutions have started to open up various types of opportunities for people to work remotely. Has this, in your experience, has this been helpful at all in terms of creating accommodations for people with disabilities, especially?
Yes, what's interesting is within the disability rights movement of the last several decades, there have been a few traditional staples. Generally, that movement has centered around independent living, increased access to healthcare, and equality in terms of both access and education, and access within education, and also the freedom to work remotely and the freedom to work from home. Traditionally, what has been the answer, I guess you could say from corporate America, as it were, is that would not be possible. That there were too many barriers technology-wise, and also that it would break the spirit of teamwork to have people working remotely from home. I know a large segment of the disability community has wanted that, because that way they could do whatever work they needed to do as part of their functions of their job, but also be able to tend to any sort of medical needs or medical appointments, and just have the freedom to do so from home. As we have seen within this pandemic, it's something that has impacted all of us. Once we saw that it was required to work from home, all of a sudden we realized we couldn't exist without Zoom and Skype and all of the other technologies, and that we could even hold entire company meetings or organizational meetings, sometimes with dozens and dozens and hundreds of people, and as you alluded to earlier, simultaneously all across the world. And so now what before was impossible is now possible. I personally believe that the landscape of work is forever altered within these times. I think what was viewed as either a strong inconvenience or again something that was an impossibility is now going to be viewed as a pretty standard part of doing business and engaging in education. And I think it'll be something that benefits us all.
Thank you very much indeed, and for a very full answer to that question. Mala, there are a bunch of questions coming in for you to do with education, especially children with special needs in relation to online learning specifically. So looking at the various questions, if I try to summarize them, probably what people are asking is not just how do you deal with children with special needs when teaching online, but also how inclusive is online learning really? You mentioned the concept of blended learning. Perhaps you could say a little bit more about that as well.
So thank you. I think these have very, very interesting answers to all this. And I think as we go along, we should be able to look at blended learning much more. I think some of the children who are severely affected by various mental or physical disabilities and people who are unable to come to school or to a place of learning, I think there it would be very, very nice if we can offer them some kind of online learning, which could be a very enriched kind of an experience. But again, when you're looking at online learning and you're looking at children with learning disabilities, it's a very, very tough task. First of all, for us as panelists here, you ask us to mute or unmute or put on the video, and it's a little kind of, for people like me, especially who's much older than I think all of you, I think it becomes a little bit of a challenge. So, but you can imagine children who are not looking at that at all. I mean, they are just shouting and they are talking in their homes, and we are also trying to teach them. We are trying to tell them, don't look outside, but look at your book right now and talk to me or talk to your friend here. It's very difficult to direct children. When you have them right in front of you, it's difficult. I have children in my special school have classes of 6 and 7. And there the teachers are often complaining that, it's so difficult even here because there are so many different kinds of levels. So online learning and blended learning, I think may be a very, very good solution going forward. But we need to train teachers again. We need to train, sorry to say, but parents also, because they would be our kind of assistants in this whole thing. And probably if we can have somebody going in to help them on the other side, and have a teacher on the other side, maybe these kind of connections can be done afterwards. But right now it is getting very, very tough. As I told you, one of the special schools is sending things actually short, that is videos short, so that the things can take place, and they send instructions to the parents through WhatsApp saying this is what is going to come, keep all these things ready. Then they have a counselor on hand who's able to mediate all this. And then, so when actually the learning happens, there is some kind of learning. How do you know learning has happened? Assessments also have to be, done online. So all these things and parents prompting them doesn't help. So these kind of things are all things that we need to surmount. But I think it's possible. It is possible slowly because it is getting accepted. In one way, thanks to the pandemic, online education is here to stay. And it is getting widely accepted by people saying that it's not bad, at least we have something. So maybe that, and more devices which are in the market, more accessible they are. I think we should be able to surmount some part of it and get more children educated.
Thank you, and that certainly chimes in with my experience here at the university as well, that online learning is here to stay in some way, shape, or form, and online conferences and online lectures and all these things. Nita, there are questions coming in about design. You've spoken a lot about design in relation to visual impairment and other disabilities. Could you talk perhaps a bit more specifically about how design can contribute to the current COVID crisis?
We are actually right in the, I would say, the eye of the storm right now. And, so what happens is one of the things that we have to really look at, and I think you and Mala, both of you mentioned, is this idea of the shift, the paradigm shift. Clearly, we are not going to go back to the same normal. Where design comes in is being able to understand where that shift should go so that it remains as efficient as our previous models have. We have had, in a way, if you look at education, the models that we have supported are physical models. They are driven by physical space. They are driven by physical interactions. They are driven by one-to-one proximities. I think some of the very important considerations have to be about how do you construct a new classroom? How do you construct a new experience that is as rich, if not richer? Given my experience over the last semester, I feel the online structures offer many, many interesting options that were not there in the physical setup that we have traditionally had. And therefore, I think it's a time for design to really start looking at some of these new ways in which, especially when we look at when we juxtapose it with the idea of disability, these can become advantages because in a way, online learning and mobility, right? You don't have to go from your home to the school or the classroom. Alex talked about this, that he's meeting people. So what is happening is you are crunching distances in a way, and you are eliminating distances. For some people with disability, those might be great advantages. So the idea is to look at from a design point of view, I think the idea is to mine some of these advantages that this new platform is providing and converting it so that, that we, instead of finding ourselves as at a disadvantage at the end of this paradigm shift, we actually find ourselves advantaged. And I have a feeling, we will get there.
It seems like we're becoming more and more optimistic. We still have a few minutes. Alex, I'm going to direct one more question to you, if that's okay. Question
Please.
that come in on the Q&A, specifically about social distancing and to what extent the call for social distancing is actually creating problems, especially for people who need direct personal care.
Certainly. I think within every paradigm, there are always exceptions, but then there are exceptions to the exceptions, meaning that social distancing is important. We see that it works. We see that it's effective. And for those that need good physical, intimate care, there may be situations where you just have to have a good informed plan as to how to help take care of that person's needs. So say in the instance of a caregiver or an educator, how to be able to handle their needs and their responsibilities within the framework of social distancing. I think of a disability, for example, of people on the autism spectrum. And oftentimes they need somebody to be physically close to them to help their needs and monitor their feelings and reactions to sound, and oftentimes help keep them calm for those that are most impacted by by sensory overload. That's something that obviously is non-negotiable. It's a need in order to be able to help that person overcoming their challenges. But it's something that should be looked upon in the lens of how can I assist this person with a disability, and how can I make sure they have a solid, reasonable accommodation while maintaining social distancing. We brought up the example before of someone who is hearing impaired or deaf who relies on lip reading. Aside from the issue of wearing a mask, let's say there is an occasion where they are able to read somebody's lips, but they need to be close enough to be able to do that. So again, you just need to have all of these things within consideration, and make sure that effective systems are communicated in terms of how can I serve your needs, how can I make sure your needs are served while maintaining social distancing that helps me and you.
Yeah. Great, thank you so much for enlightening us on that particular topic. Because distancing on the one hand sounds like even more excluding, but as you point out, it is also a way of caring for the other person. So, Mala, there's a very interesting question that's come in just now, specifically about the attitude of parents towards inclusive education, especially when migrant students are included in schools where they were not previously present. Would you be willing to comment on that?
Sure. I think what's happened is there has been a lot of policy changes that have been brought about, and they have tried to see to it that many of the so-called good schools and schools which have resources would include necessarily some children who are disadvantaged. Now, there was a lot of disparity, and sometimes in some of the schools, if there is no difference in their viewing of these children, if the teachers were not sympathetic, if the whole place was not empathetic towards the solution, these children were anyway excluded from many of the activities and things like that. So now I think if we are looking at giving people more opportunity, and if all of us have become more sensitive to these kind of exclusions which are happening in society, I think it should be possible for these children to be included wholeheartedly in many of the better schools, and to provide them with the best that we can do. And this, I think, is something that society needs to change. I don't think this is a pandemic issue. I think this is an issue which is, I mean, this kind of a difference is itself a pandemic in our society, that we have these differences of haves and have-nots. And even in the richest countries, I think there have always been these divides, which is a very unnatural kind of a divide. And when you look at it, and when great philosophers have always said that we are all one, I don't think we actually listen to that. When we look at children with autism, I mean, in many places in India, they say that they are mad. And there are people who are, unable to hear, and they term the child, as wanting in intelligence. So there is not much of a kind of awareness of that. I think nowadays this is getting much better. I think more education means more awareness, and I think more empathy. That is what the education should do. I think in places like your university, for instance, you're looking at sensitizing people more with more education, not to become more divided, or to say that I'm better, or that I'm more than you just because I have more education. But it should be that you are able to come down to the level of the first time, the very lowest, or whatever you consider to be so-called low from your great normal height that you look at yourself to be. I mean, these are kind of things that we need to look at very, very seriously. Migrant children who don't have, children who are in the streets, children who work, for instance. I mean, there we have quite a number of these problems. Child labor is a huge problem anyway. And these kind of problems, I think if we have blended learning, it's possible that these children may be able to come to school, or come to a place where somebody can afford them some distance learning, in some place where they can actually learn and become better. Many of the older people, the mothers, for instance, one of the places where we had donated computers, the mothers said, what is this thing which the children are so fascinated, we really want to know, what is this machine that children are getting so excited about? So they wanted to learn. So they wanted to learn what the computers would do. They were so excited about that. And to learn that, they had to learn English. So, this is something which can lead on to many, many better and better things, but we need to keep an open mind.
Great. Thank you so much. So one sort of slight disadvantage of this sort of online activity that we have is that our attention span seems to be shortening, and it is therefore less customary, I think, with these online events to go over time compared to in-person events where I could look around the room and think, oh, people are still interested. Let's go on for another half an hour. So we're not going to do that, but I am going to ask all the panelists in reverse order to leave us with 30 seconds of final words of wisdom. So I'm going to start with Nita, and then Mala, and then finish with Alex. So Nita, if you would give us your 30 seconds takeaway, please.
Thank you, Michelle. I believe that the main goal of design is not just to design for people with disabilities, but design to reduce marginalization. There's a very important shift that needs to happen. Reimagining the boundaries and definitions of mainstream and the marginalized is extremely important. That equal accessibility for all cannot be an aspiration, but needs to be viewed as a fundamental right of every individual in an equitable society. In unprecedented times like these, the most important task is to ensure that the marginalized are not further pushed to the periphery. They need to be viewed as an integral part of our societies.
Thank you very much for these wonderful words of wisdom. Mala, your final message to our audience.
So as I said, I think the pandemic has cracked open the world, but this cracks, I think, can really show us a lot of light coming through. And we can also look out and see the kind of possibilities that are there. One of the things I really want to leave everybody is to value the teaching profession. They've really risen to the task, though they do need a lot more of training, and they are looking at much more information. I think it's time for us to value them, and right now, to make open source whatever apps and free technologies. I think for education, I think this is very, very important. We don't need to buy things and have a content which is so expensive that we cannot afford it, or have children pay for it. I mean, these kind of things, I think, are something which we really need to look at again. And I think you need a global kind of an endeavor to end this inequality and inequity in education. I think that is something we really, really need to work towards. And I think this pandemic may have given us a time to pause, a time to rethink, and a time to re-evaluate many of the things that we are doing so blindly just going on.
Thank you very much. So Alex, the floor is yours for the final words of wisdom of this event.
Sure. The University of Notre Dame has taught me to combine faith with reason. And within that structure, I have really looked upon this entire time of the pandemic as an opportunity to see the good. As much destruction and pain as there has been caused, there are also things that we can learn from all of this. I believe that these times have really put all of us on an equal plane, and that includes those who are disabled and those who are non-disabled. Going back to the challenge or the opportunity of working from home and telecommunications, it's something that we've all utilized, and it's something that we see can benefit all of us. So within that spirit, I would encourage people to continue to see how now those walls are down, and we need to, as people who are non-disabled, be able to look upon the disability community and say, how can I help this community out so that they can continue to thrive and have as much equality as possible. If you look at it, for example, in my state of California, we are allowed currently to have outdoor dining. And I know that's the case in many other states. But one challenge with that is that makes those restaurants even more inaccessible for, say, people in wheelchairs. So I would strongly encourage everyone here today to look for ways that you can continue to advocate for the disability community, that you can continue to be an ally. Utilize this time as an opportunity to have your eyes open, so to speak, and be able to serve as the ally. And remember that this is something that will benefit all of us moving forward.
Thank you so much. Thanks again to all three panelists. Many thanks also to Colleen Geyer for providing American Sign Language simultaneous interpretation. We were very grateful to have you here. Thank you to you, our audience, wherever you are in the world. This is the final event in this particular series, but it's certainly not the last online event that the Liu Institute will be producing. So please look out for announcements of more events over the coming months from the Liu Institute for Asia and Asian Studies at the University of Notre Dame. It's been wonderful to have you here. Thank you for your support. Stay safe, stay healthy, and goodbye.